Hello, and welcome. Today we're diving deep into a lesser-known but devastating heart condition, endomyocardial fibrosis, or EMF. This restrictive cardiopathy primarily affects people in tropical and subtropical regions, and understanding it is crucial for early diagnosis and effective management. The exact cause of endomyocardial fibrosis remains a mystery, but several factors are thought to play a role. These include parasitic infections, particularly filariasis, dietary deficiencies, specifically a lack of essential nutrients, genetic predispositions, suggesting a hereditary component, and environmental toxins. It's likely that a combination of these factors contributes to the development of the disease. Endomyocardial fibrosis is characterized by the thickening and stiffening of the inner lining of the heart, the endocardium, and the adjacent myocardium. This fibrosis primarily affects the ventricles, restricting their ability to fill with blood. The stiffening reduces the heart's pumping efficiency, leading to impaired cardiac output and eventually heart failure. The atria often become enlarged, and thrombus formation, or blood clot formation, is common in the affected chambers. This can lead to embolic events, where clots travel to other parts of the body, causing stroke or other serious complications. Endomyocardial fibrosis is most prevalent in equatorial Africa, South America, and parts of Asia. While the exact numbers are difficult to ascertain due to underreporting and diagnostic challenges, it is estimated that millions are affected worldwide, particularly children and young adults in these regions. The disease is often associated with poverty and poor sanitation, further contributing to its prevalence in underserved communities. The signs and symptoms of endomyocardial fibrosis can vary depending on the severity and extent of the fibrosis. Common symptoms include shortness of breath, especially with exertion fatigue, swelling in the legs and abdomen, known as edema and ascites, respectively, chest pain, palpitations, and cough. In advanced stages, patients may experience severe heart failure, characterized by extreme fatigue, difficulty breathing even at rest, and significant fluid retention. Diagnosing endomyocardial fibrosis requires a comprehensive evaluation. A physical examination can reveal signs of heart failure, such as an enlarged heart, abnormal heart sounds, and fluid accumulation. An electrocardiogram, or ECG, may show abnormalities in the heart's electrical activity. Chest X-rays can help identify an enlarged heart or fluid in the lungs. However, the most important diagnostic tool is an echocardiogram, an ultrasound of the heart, which can visualize the thickened endocardium, assess ventricular function, and detect any blood clots. Cardiac MRI can also be useful in certain cases for a more detailed assessment of the heart tissue. While there aren't strict classifications or types of EMF like some other diseases, its presentation can vary depending on which part of the heart is most affected. Some cases predominantly involve the right ventricle, leading to symptoms of right-sided heart failure. Others primarily affect the left ventricle, causing left-sided heart failure symptoms. In many cases, both ventricles are involved. Recognizing which ventricle is most affected helps tailor the treatment approach. The treatment of endomyocardial fibrosis focuses on managing the symptoms of heart failure and preventing complications. This typically involves medications such as diuretics to reduce fluid overload, ACE inhibitors or angiotensin receptor blockers to improve heart function, beta blockers to slow the heart rate, and anticoagulants to prevent blood clot formation. In severe cases, surgery may be necessary to remove the fibrotic tissue, a procedure known as endocardiectomy. Heart transplantation may be considered as a last resort for patients with advanced disease. Currently, there is no known way to completely prevent endomyocardial fibrosis, given the uncertain etiology. However, focusing on public health initiatives in endemic regions can help reduce risk. These initiatives include improving sanitation and hygiene to prevent parasitic infections, ensuring adequate nutrition, particularly for children and pregnant women, and controlling mosquito populations to reduce the spread of filariasis. The prognosis for patients with endomyocardial fibrosis varies depending on the severity of the disease and the availability of treatment. Without treatment, the prognosis is generally poor, with a high mortality rate. However, with appropriate medical management and, in some cases, surgery, patients can experience significant improvements in their quality of life and survival. Recent research is focusing on identifying genetic markers for EMF, developing more effective diagnostic tools, and exploring novel therapeutic strategies, such as targeted therapies to reduce fibrosis and prevent disease progression. Continued research offers hope for improved outcomes for individuals affected by this challenging condition.